Hey everyone, and welcome to the Deep Dive. I'm Brian, and today we're going to be taking a really close look at a mineral that's absolutely essential for your health, calcium. And to help guide us through this deep dive, we've got the amazing Chelsea here with us, whose knowledge of nutrition, I think, fill an entire encyclopedia.
That's a big compliment. I appreciate that. And hello to everyone listening from Detox Health.
You probably already know that calcium is really important for strong bones.
Of course.
But did you know that your body can't actually make it on its own?
Right.
We rely entirely on outside sources to get the calcium that we need.
Absolutely.
And that's really what we're going to be focusing on in this deep dive.
Yeah, every bit of calcium in your body comes from what you eat and drink, and it's needed for so many bodily functions, like muscle contractions and nerve impulses, even regulating your heartbeat.
It's kind of fascinating how something that we often associate with just like bones is involved in so much more.
Absolutely. And here's where it gets kind of interesting. Despite its importance, many people, especially in the U.S., just don't get enough calcium in their diet. And this can create a calcium gap, which can lead to various health issues down the line.
A calcium gap, huh?
Yeah.
So how much calcium do we actually need? I imagine it varies depending on age and other factors, right?
You're absolutely right. It does vary. And according to the Mayo Clinic, for men aged 19 to 50, the recommended daily intake is 1,000 milligrams. This stays the same for men aged 51 to 70, but then it bumps up to 1,200 milligrams for men 71 and older. For women aged 19 to 50, it's also 1,000 milligrams per day. But unlike men, the recommendation for women jumps to 1,200 milligrams per day from age 51 onwards.
So men generally need around 1,000 to 1,200 milligrams per day.
Yeah.
And women need a bit more, especially as they age.
Yeah.
So how do we actually make sure that we're hitting those targets? I know some people swear by supplements, but I'm guessing food is the ideal source.
You guessed right. Food is always the best and safest way to get any nutrient, and calcium is definitely no exception.
So where should we be looking for these calcium-rich food stars?
Yeah, so dairy products are probably what comes to mind first.
Yeah.
So, your milk, your yogurt, your cheese. But for those who can't or choose not to consume dairy, there are plenty of other options out there.
Yeah, I'm lactose intolerant myself, so I'm kind of all ears for those non-dairy sources.
Well, leafy green vegetables are fantastic sources. Things like kale, spinach, collard greens. They're nutritional powerhouses in general, and their calcium content is definitely a big plus. Did you know that 1 cup of cooked collard greens actually has more calcium than a glass of milk?
No, I did not know that. That's a great tip for our listeners.
Right.
What about those who just aren't big fans of leafy greens?
Yeah.
Are there any other unexpected calcium heroes out there?
Yeah, you might be surprised to hear that canned salmon with bones is another great source. The bones are soft and completely edible, providing a good dose of calcium.
Canned salmon with bones. That's a fact I'll be sharing at my next dinner party.
Please do.
What about for our vegan listeners?
So for vegans, soy products like tofu tempeh and soy milk are all great choices. And let's not forget about almonds, chia seeds, even oranges. They all contribute to your daily calcium intake.
Wow, that's an impressive list. I'm actually feeling much more optimistic about hitting my calcium goals now.
Good.
We've got dairy, we've got leafy greens, salmon, soy products, nuts, seeds. Anything else?
Oh, there are a few more surprises.
Right.
For instance, flour tortillas.
Really?
And even canned baked beans can contribute to your calcium intake.
Flour tortillas, never would guess that.
I know, right?
This is why we have you on the show, Chelsea. You're an absolute encyclopedia of calcium knowledge.
Thank you.
And speaking of impressive knowledge, folks, please hit that like button if you think Chelsea is more than just a pretty face. And don't forget to subscribe to the Detox Health YouTube channel for more insightful deep dives, just like this one.
Thanks, Brian. Now let's talk about those situations where even with a good diet, we might need a little extra boost from calcium supplements.
So when might someone need to consider supplements?
Individuals following a vegan diet, those with lactose intolerance, or people who consume a lot of protein or sodium, they might need to consider supplementation. Also, certain medical conditions and medications can interfere with calcium absorption.
So in those cases, working with a doctor or a registered dietitian is probably crucial to determine the right course of action.
Absolutely. It's always best to consult a healthcare professional before starting any new supplement regimen. They can help you assess your individual needs and ensure that you're making the safest and most effective choices for your health.
Great point. Now, before we dive into the world of supplements, let's address the elephant in the room. I know some people are kind of wary of calcium supplements due to potential risks, right?
You're right. While calcium is essential, there's a lot of discussion about high-dose calcium supplements and their potential link to health issues like kidney stones and even heart problems.
So moderation is key, especially when it comes to supplements.
Exactly. Sticking to the recommended intake levels and prioritizing calcium from natural food sources is always the best approach. We'll dive deeper into the potential risks and benefits of supplementation in the next part of this episode.
Okay, that's something to look forward to. And speaking of essential partners, we can't forget about the crucial role vitamin D plays in calcium absorption, right?
You're absolutely right. Vitamin D is like the key that unlocks the door for calcium to enter our bones and do its job.
Wow.
Without enough vitamin D, our bodies can only absorb about 10 to 15% of dietary calcium.
So even if we're eating all the right calcium-rich foods,
we're
still missing out if our vitamin D levels are low.
Exactly. That's why getting enough of both is so important.
Right.
They work together to keep our bones strong, our muscles functioning properly, and our overall health in check.
Gotcha. We'll be exploring this fascinating vitamin D connection in a lot more detail later in this deep dive.
Yeah, we will.
I'm really excited to learn more about that. This has been a fantastic deep dive so far, Chelsea.
Thank you.
I really appreciate it.
You're welcome.
Welcome back to our deep dive into the world of calcium. Before the break, we were talking about those situations where calcium supplements might be necessary. So, Chelsea, what are some things that people should keep in mind when they're choosing a supplement?
It can definitely feel overwhelming, when you're staring at just rows and rows of supplements.
Right.
But one key thing to remember is that they're not all created equal.
Yeah.
Different calcium compounds are used, and they don't all contain the same amount of elemental calcium, which is the amount that your body can actually absorb.
Elemental calcium. So it's not just about the total milligrams listed on the label.
Right. You need to look for the amount of elemental calcium per serving.
Gotcha.
For example, calcium carbonate, which is a very common and affordable type. It contains about 40% elemental calcium. So if a supplement has 1,000 milligrams of calcium carbonate, you're actually getting around 400 milligrams of elemental calcium.
Okay, that makes sense. Are there certain types of calcium supplements that are generally recommended?
Calcium citrate is a good option for many people.
Okay.
It's gentler on the digestive system, and it's known to be absorbed well, even if you have low stomach acid.
That's good to know, especially since low stomach acid becomes more common as we age.
Yeah.
Anything else we should be looking for on those labels?
Definitely check for independent lab testing. Look for seals from reputable organizations. Like the U.S. Pharmacopeal Convention, USPConsumerLab.com, CSL, or NSF International. They ensure that the supplement actually contains what it claims and is free from any harmful contaminants.
Those abbreviations are really helpful. It's like having a secret decoder ring for supplements.
Right.
So we've got elemental calcium, different types of calcium compounds, independent lab testing. Anything else we need to think about when we're navigating this world of calcium supplements?
It's also important to think about the form of the supplement.
Yeah.
They come in tablets, capsules, chewables, liquids, even powders.
So many options.
Yeah.
How do we know which form is best?
It really depends on your personal preference.
Okay.
If you have trouble swallowing pills, chewables or liquids might be easier. And remember, all types of calcium supplements are absorbed better when taken in smaller doses, ideally 500 milligrams or less with meals.
So spreading out your calcium intake throughout the day is a good strategy.
Yeah.
Now, before we wrap up this segment on supplements, you mentioned earlier that there are some concerns surrounding excessive calcium intake. Can you kind of elaborate on those a little bit?
Yeah, one of the biggest concerns with high calcium intake, particularly from supplements, is the potential for kidney stones.
Yeah, nobody wants kidney stones.
Yeah.
So how does that actually happen?
When there's too much calcium in your bloodstream, it can bind with other substances and form crystals in the kidneys, which can be quite painful.
Ouch, yeah. Kidney stones are definitely something I want to avoid.
I think we all do.
Are there any other potential risks associated with high calcium intake?
Some research suggests a possible link between high calcium intake, again, particularly from supplements, and an increased risk of cardiovascular problems such as heart attacks or strokes. However, this is still being studied and the evidence is not conclusive.
It's always important to consider both the potential benefits and risks, right? Especially when it comes to supplements. Chelsea, I'm curious, are there any particular groups of people who are maybe more prone to calcium deficiency?
There are definitely certain populations who need to be extra mindful about their calcium intake.
Okay.
Vegans, for instance, often need to pay closer attention to their diet or consider supplements since they're not consuming dairy products.
Yeah.
People with lactose intolerance also face similar challenges.
Well.
And individuals with certain medical conditions, such as celiac disease or inflammatory bowel disease, may have difficulty absorbing calcium properly.
It sounds like there's a lot of individuality when it comes to calcium needs, and consulting with a healthcare professional is probably crucial to determine the best course of action.
Absolutely. They can assess your individual risk factors, dietary habits, and medical history to help you make informed decisions about your calcium intake.
Now, before we move on, I want to circle back to something we touched on earlier, the important relationship between calcium and vitamin D. Why is vitamin D so crucial for calcium absorption?
Think of vitamin D as a key that unlocks the door for calcium to enter your bones.
Okay.
It helps your intestines absorb calcium from the food you eat. Without sufficient vitamin D, your body can only absorb about 10 to 15% of dietary calcium.
Wow, that's a huge difference. So even if we're diligently consuming calcium-rich foods,
Right.
it won't do us much good if we're lacking vitamin D.
Precisely. They work synergistically like a dynamic duo to ensure your bones stay strong and healthy.
This reminds me of those old buddy cop movies. Calcium and vitamin D fighting crime together, keeping our skeletons from crumbling.
That's a great analogy.
Right.
And speaking of this dynamic duo, let's delve into the details of vitamin D in the next part of our deep dive.
Okay.
We'll explore how much you need the best sources and what happens when you don't get enough.
Sounds good. Stay tuned, folks, for the exciting conclusion of our calcium adventure. Welcome back to the deep dive. We've been exploring the world of calcium, and before the break, we were teasing the really crucial role of vitamin D in this whole equation. So, Chelsea, let's dive right into the details. How much vitamin D do we actually need to effectively partner with all this calcium?
For adults up to 70 years old, the recommended daily intake of vitamin D is 600 international units, or IU. And for those 71 and older, it bumps up to 800 IUs per day.
Okay, so just as with calcium, our vitamin D needs can change as we age now. How do we actually make sure we're getting enough of this sunshine vitamin?
Well, the name sunshine vitamin is a good clue. When our skin is exposed to sunlight, it actually triggers vitamin D production. But of course, we need to be mindful of sun safety and avoid excessive exposure.
Yeah, soaking up some sun in moderation sounds like a good strategy. But what about for those of us who live in places with limited sunshine or during the winter months? Are there any reliable dietary sources of vitamin D?
You can find good amounts of vitamin D in fatty fish like salmon, tuna, and mackerel egg yolks also contribute some vitamin D, and many foods are fortified with vitamin D like milk and certain cereals.
Okay, so those fortified foods could be helpful for boosting our intake. But what if we're still falling short? Even with diet and some sunshine, are vitamin D supplements a good option?
Yes, vitamin D supplements can be helpful in those cases. They typically come in two forms, D2 ergocalciferol and D3 cholecalciferol.
Okay.
D3 is generally considered more effective at raising blood levels of vitamin D.
So D3 is the one to look out for if we're considering supplements. Any tips for choosing a good quality vitamin D supplement?
Similar to choosing calcium supplements, look for reputable brands that have been independently tested for quality and purity, and choose a form that's easily absorbed, like oil-based capsules or drops.
Okay, great advice. Now, let's talk about what happens if we don't get enough vitamin D. What are the consequences of being deficient in this crucial nutrient?
Vitamin D deficiency can lead to a condition called hypocalcemia, which means low levels of calcium in the blood. This can weaken bones, lead to muscle weakness, and increase the risk of fractures in children. Severe vitamin D deficiency can even cause rickets, a condition that affects bone development.
Wow, those are some serious consequences. It really highlights just how vital vitamin D is for our overall health and not just bone health.
Absolutely. And it's important to remember that vitamin D plays a role in many other bodily functions beyond calcium absorption. It supports immune health, cell growth, and may even play a role in protecting against certain chronic diseases.
It sounds like vitamin D is a true multitasker. Any final thoughts for our listeners on calcium and vitamin D before we wrap up this deep dive?
I think the key takeaway is that these two nutrients are essential partners in supporting our health throughout life. By focusing on both calcium-rich foods and adequate vitamin D intake, we can give our bodies the building blocks they need for strong bones, optimal muscle function, and overall well-being.
Chelsea, this has been an incredibly informative deep dive. I really appreciate you taking the time to be here with us.
It's been my pleasure, Brian. Thanks for having me, and thanks to all of you listening from Detox Health.
And that concludes our deep dive into the world of calcium and vitamin D. Remember, if you have any concerns about your nutrient intake or your overall health, it's always best to consult with your healthcare provider. They can help you determine the best course of action based on your individual needs and circumstances. And for more fascinating deep dives into the world of health and nutrition, be sure to subscribe to the Detox Health YouTube channel. Until next time, stay curious, stay informed, and stay healthy.